1 in 3 people have fatty liver, and many don't know they have it. The problem is, it's not always easy to know if you have fatty liver. Oftentimes, symptoms only appear when your liver is in bad shape. However, there are subtle warning signs you can look out for. So in this video, I'm going to show you exactly what those signs are. This could potentially change the trajectory of your life. Because left untreated, fatty liver disease can lead to liver failure and liver cancer. Fatty liver is also a major risk factor for cardiovascular disease, diabetes, dementia, and so much more. The good news is if you catch it early, there are many things you can do to slow down and even reverse some of the damage that's accumulated. That's why it's crucial to know the early warning signs and symptoms. And pay close attention to number 10 because it's one of the biggest red flags that your liver is in big trouble. Now, what exactly is fatty liver? Fatty liver, also known as hepatic steatosis, is the accumulation of excess fat in the liver due to poor lifestyle choices. This buildup of fat over time can impair liver function, cause inflammation, and open a whole cascade of problems. The most common complication is scarring of the liver, also known as fibrosis. Now, there's 4 different stages of scarring or fibrosis of the liver. The first stage is called early fatty liver. It's a buildup of fat in the liver, mostly due to poor diet, and may only be diagnosed on a liver function test. This is why you need to get routine yearly blood work once you get into your late 20s and early 30s. You can't just hope and pray that you're not gonna die. Stage 2 is non-alcoholic steatohepatitis, or NASH for short. NASH is an advanced form of non-alcoholic fatty liver disease where the liver has become a bit more inflamed and damaged. Stage 3 is what I mentioned earlier, fibrosis. Fibrosis is the first stage of liver scarring. Now, some fibrosis can be reversible, and the liver is still able to function normally, but you're now on borrowed time. The final stage is cirrhosis. Cirrhosis is a type of liver damage where healthy cells are replaced by scar tissue. The liver is unable to perform its vital functions of metabolism, production of proteins, including blood clotting factors, and filtering of drugs and toxins. Cirrhosis can eventually lead to liver failure and raises your risk of liver cancer. You want to do everything in your power to avoid this end stage, so make sure to stick around until the end to find out how. Now, there's 2 primary causes of fatty liver: alcohol and metabolic syndrome. Alcohol is pretty straightforward. It's literally poison to the human body, which the liver has to deal with. That's why there's no safe amount of alcohol to consume. It's strongly associated with the development of fatty liver. Now, the other root cause of fatty liver is an overall poor metabolic health. This includes being overweight and obese, diabetes, hypertension, high triglyceride levels, and low HDL cholesterol. Again, stick around until the end to learn how to fix fatty liver. You need to know the early warning signs first. Ask your doctor to check for fatty liver if you regularly drink alcohol, have any of the metabolic risk factors I just mentioned, or if you have any of the warning signs I'm about to give. Again, fatty liver disease is notoriously difficult to pick up before it starts damaging the liver. Now, the first and most common way to find out if you have fatty liver is through a blood test. The problem is it's typically gonna come out normal, even if you already have a fatty liver, unless it's really bad and you're dealing with fibrosis or cirrhosis. It's all about being proactive. And there are now more advanced tests for fatty liver you can request, like an AST and GGT. You can also get an MRI of your liver or a liver fibroscan. Your liver fat should be less than 2%. The problem is some people could have liver fat of 20% or more. That's a problem because fat around your liver again creates inflammation and causes absolute metabolic chaos to your body, which then triggers a whole cascade of problems, which oftentimes manifests itself as the first warning sign: persistent fatigue and weakness. If you often feel tired despite getting 7 to 8 hours of sleep, it could be a sign you have fatty liver. It's absolutely not normal to feel like crap all the time. The excess fat in the liver can disrupt its normal functions, leading to lack of energy. You generally just don't feel well. Again, Fat in the liver leads to inflammation and the release of pro-inflammatory cytokines. These cytokines then go throughout the body and can contribute to feelings of fatigue and weakness. Your liver also regulates much of the storage, release, and production of energy for your body. When you deposit fat in areas where it shouldn't be, that starts to affect how efficiently the liver can do its job. The next sign is poor concentration and brain fog. One of the important functions of the liver is to break down toxins. As fatty liver disease progresses, it's not able to do that critical job as well. As toxins, including ammonia, build up in the blood, it can lead to brain fog, poor memory, poor concentration, and poor cognitive function overall. You're just not as sharp. The next warning sign is abdominal pain on the right side. Pay close attention to any pain in your abdomen, specifically in the right upper quadrant, right under your right rib cage. People with fatty liver may experience mild to moderate pain in that area. It can be a result of inflammation or enlargement of the liver due to the fat accumulation. As the liver gets enlarged, it stretches the capsule that covers the liver. Pain and discomfort in that area can then occur. The next warning sign is unexplained and significant changes in your weight, especially if you're not trying to gain or lose weight. If that's the case, you may need to have your liver checked right away. It goes without saying that being overweight or obese due to poor diet is a major risk factor for fatty liver and a boatload of health problems. If you're overweight and are diagnosed with fatty liver, losing weight can be one of the most effective interventions to reverse it. On the other hand, rapid weight loss, especially if you're not trying to lose weight, can be a problem as well. It can often be a sign of severe malnutrition due to fatty liver, especially if things have progressed to the point where your liver has become fibrotic or scarred. Again, this is due to the chronic inflammatory process that's going on in the liver, resulting in these inflammatory molecules and toxins circulating around your bloodstream. And if you're not feeling quite right, you're feeling nauseous, you have no appetite, and you feel a bit sick, you're probably not going to be eating as much as usual, resulting in rapid and unwanted weight loss. Now, the next signs and symptoms often come from fibrosis and cirrhosis of the liver. Pay close attention, because if you have any of these symptoms, you need to see a healthcare professional right away. Now, the most obvious and visible signs are jaundice or yellowing of the skin, palmar erythema or redness of the hands, spider angioma, edema, and ascites, which is excessive fluid in the abdomen. Those can be signs of significant liver damage and scarring. You often see it in people that haven't gotten a routine health checkup or they haven't paid any attention to their diet and lifestyle. Those aforementioned signs is your body's last-ditch effort to signal that something is wrong. Jaundice is caused by increased levels of bilirubin in the blood. It manifests itself as yellowing of the skin and eyes. It's very hard to miss. And while jaundice is usually more common with other types of liver disease, it can happen as a result of fatty liver. Advanced fatty liver disease can also cause fluid to leak out of the blood vessels. This can lead to ascites, which is excessive fluid in the abdomen and becomes visible in the stomach area. These people literally look pregnant. Excess fluid can also manifest itself in the legs, also known as edema. Not a pretty sight. Other visible advanced fatty liver signs include redness of the hands, as well as changes to the blood vessels, which results in a rash that literally looks like a spider. The next fatty liver sign is itchy skin. If you have itchy skin with no obvious rash, especially if it's persistent and you're experiencing some of the symptoms I've mentioned so far, it might be worth getting your liver checked. The persistent itch people get with advanced liver disease is most likely caused by a buildup of bile salts. Bile salts, normally produced by the liver, helps with digestion. But as it builds up in higher levels because your liver isn't functioning properly, it could cause irritation. The next sign is loss of libido. Having high libido is often an indicator of good health. So if you notice you have a noticeable decrease in your sex drive, this can sometimes be linked with fatty liver disease. It's also often associated with metabolic syndrome complications. The next sign is if you notice you bruise easily. As mentioned earlier, the liver plays a key role in producing clotting factors. When people have severe fatty liver disease, you tend to see them suffer more from unexplained bruising, Or when they get a cut, it can take unusually longer for their blood to clot. This is also closely related to poor blood sugar regulation, also known as diabetes. The next sign is dark urine. If you notice that your urine is darker in color, that is a major red flag for severe fatty liver. As mentioned earlier, bilirubin accumulating in the body can give you a yellow tinge. So when it's excreted out of the body through the urine, it can make your urine look darker. At times, the urine can also be foamy. That's also often a sign that your kidneys aren't functioning properly. The next sign is pale stool. Since we're in the topic of bowel movement, the usual brown color in your stool comes from bile salts. So when you have severe fatty liver disease, you can get a distinct paler looking stool. The stool can also look a little bit oily or greasy. It's because your ailing liver is not producing the right products to break down fat. That fat is then excreted out of your body through your stool. Which brings us to one of the most important warning signs of severe fatty liver: tarry and black stool, also known as melena. The black stool color is caused by enzymes breaking down and digesting the blood as it moves through the GI tract. This color is often accompanied by a strong foul odor. Sometimes it could also come out the other way. So if you're vomiting blood, it's time to go to urgent care. And if you have any of the risk factors, warning signs, and symptoms we talked about, ask your doctor to get checked out for fatty liver. As always, awareness is always the first step. Now, if you enjoyed this video, then you don't want to ignore this one. I'll see you there.